It's interesting. Most people think to diagnose a certain health condition, they need to go to their doctor and have a blood test or some other diagnostic work done. There is a simple home test people can use for diagnosing thyroid problems. Could you talk about the Barnes-Basal test for
Sure.
thyroid function?
I just want to put this in perspective because I did write about it extensively in the book. It really is not a diagnostic test. It's a presumptive test. In other words, if you're suffering with a number of the symptoms which we've discussed, particularly chronic fatigue, and it can be a whole host of other symptoms, and you suspect or a person thinks that it could be their thyroid or is unsure whether or not it's their thyroid, the simple test is just to shake a thermometer down. We used to be able to get the mercury thermometers, which have been actually banned because of environmental reasons. But if a person uses a basal thermometer and puts it snugly under their arm, first thing in the morning, the temperature reading, the axillary temperature, in other words, the underarm temperature, you leave it there for 10 minutes, should be between 97.8 and 98.2 on the Fahrenheit scale. If it is below 97.8 and you're symptomatic, a person should see a holistically oriented doctor to see whether or not their thyroid is involved, and more often than not it is.
I know when I was diagnosed with underactive thyroid in 1984, my body temperature in the morning was about 96, and after being on Armour thyroid for about a month, my body temperature went up to about 97.9.
There's no doubt about it, because when you're on thyroid medication, it does rev up the metabolism of all your cells. That's why, that's why Barnes was a genius. Back in the old days, when, by the old days, I mean, before laboratory medicine became more sophisticated, the way the doctors would tell whether or not a person had a thyroid condition was using a piece of apparatus that did a basal metabolic temperature, a basal metabolic test, where you came in to a hospital and they put you on a breathing apparatus to see what your metabolism was like first thing in the morning. The closest thing that Barnes found that correlated with this clunky, expensive piece of equipment was a basal temperature test first thing in the morning, because the sum total of all the metabolic activity that's going on in your body is reflected in your resting temperature. So your resting temperature does give a good presumption of what your metabolic status is, and to extrapolate from that what your thyroid status is. So if your body is freezing and your temperature is subnormal every morning, there's a good chance that, and you have multiple clinical symptoms, there's a good chance your thyroid can be involved. Now, let me just say one thing, because I say this to my patients. There are other things certainly that can cause low body basal temperature that are not thyroid related. People have had viral conditions where they may have elevated antibody titers of certain viruses, like Epstein-Barr virus, and anybody who's ever had mono has Epstein-Barr floating around in their bloodstreams, at least antibodies, all their lives. And I'm using this as a metaphor. Since Epstein-Barr is a member of the herpes family, when a person's immune system becomes stressed, the virus, which never leaves the body, can become more active. And in certain viral conditions, your basal body temperature can actually go down. Frequently see this in people who have colds. Their temperatures go down rather than go up.
So just a simple at-home measurement of the body temperature can
All
go a long way.
All you need is a basal thermometer under your arm, and you can, and if you've been sick and suffering, you can get a good idea whether or not there's a probability of your thyroid being involved, and then go see somebody who uses thyroid medication in their practice. Okay. And if need be, try it. And for the people who need it, very often their lives are turned around, and pretty rapidly.
Well, thank you, Dr. Langer, and I urge everyone to pick up a copy of Dr. Langer's fascinating book, Solved: The Riddle of Illness.